What treatments are available right now that work best for ME/CFS, myalgic encephalomyelitis, chronic fatigue syndrome, and long COVID? There's a new paper out that asks that question of about 3,925 patients, and the results give us a list of treatments to consider. So let me give you the sneak preview to the treatment ratings right here. And after I give you the essential details of the study, we'll go back to this main figure and we'll discuss the most critical findings. Now, before I do that, here are the disclosures for this talk. I was not involved in this research project. And here is the paper. Now, this is an open access paper, which is great. It means you can grab the paper yourself. I put the link in the description. And I believe this paper was available first as a preprint, and I've talked about those before, but it's now peer-reviewed and now it's officially published. Now, this is a great group of researchers. You may recognize some of the names. They've been working in this field for a long time and they take it very seriously. The main idea behind this paper is there are no FDA-approved treatments for ME/CFS or long COVID. So what are people supposed to do right now? What does anything work that you can use right now? So what did the research team do? They looked, as I mentioned, at over 4,000, almost 4,000 people. You can see here that it was 1,759 ME/CFS individuals and 1,376 long COVID individuals. They do make a point to mention that almost 90% of the ME/CFS group reported that they have post-exertional malaise, and just short of 80% of the long COVID group reported post-exertional malaise as well. Now you can see here that the sample was approximately 80% female. I think having a 20% male representation is pretty good in this field. And I should also note that over 80% reported being formally diagnosed with ME/CFS and long COVID. They didn't just self-diagnose. And you can look at the other demographics here. They're all important, but it takes too much time to cover them all in one talk. So the study used an online survey, and that survey is still available online. You can find the link in the paper. That means this is not a clinical trial. They just were asking people, the people who accessed the survey, they asked them about their experiences with different treatments. It was a pretty comprehensive survey. They asked over 400 questions. They asked for symptoms and the treatments they tried and the dosage and the side effects and everything they could think of. Now this figure right here shows the most problematic symptoms that the respondents gave, and the most endorsed ones are at the top. Blue is ME/CFS, and the reddish color is long COVID, and they mostly look the same. And so the ME/CFS and long COVID groups were generally the same on a lot of things they looked at. They both had the number one issue being fatigue. Then you see post-exertional malaise is the number two issue, and then the number three issue is brain fog. And then you can go on to the other issues that they reported. All right, so let's go back to the main results figure. And they asked about over 150 treatments, but they only show the top 20 rated ones right here. And that's just to simplify the paper or the main part of the paper. So let me break this down for you because there's a lot here. On the left is the treatment name. Next to that are how many people reported trying the treatment, just the number of people who tried it. So lots of people tried antihistamines, but only 58 people tried Maraviroc, which is an antiretroviral. Next is the percentage of people who responded to the treatment. This is probably the most important part. Orange means they got much better after they tried the treatment, and the yellow-orange means they got moderately better. So the further the oranges go to the right, the more people who benefited from that treatment. And on the blues, it's just the opposite. This is how many people did worse on the treatment. And so the further the blues stretch to the left, the more people that had an issue or some problem with the treatment. And then way out on the right in green tells you which symptoms were positively impacted by the treatment. So there's a lot of information squeezed into this single figure. I'm not going to discuss each treatment, even though each treatment is really interesting. There's just so much to talk about behind each one. I just can't do that in this talk. I'll probably talk about some specific treatments in later talks. For now, I'm just going to point out a few things, and then you can look through and read the rest yourself. First, we see that immunoglobulin and the antiretroviral meds had the highest positive response, but they both also had the lowest number of respondents. They were pretty small sample sizes. I'm guessing that is not a coincidence, but I can't know for sure. I'm guessing it probably was a more selective group that tried these. So in any case, we'll have to see more data from more people to know what that true response rate is going to look like. It still looks good. We see next that pacing helped a lot of people. Now, pacing is absolutely a legitimate approach to minimizing symptom severity, but pacing also means reducing activity. So I can't really call pacing a treatment because the goal of treatment is to increase functioning and activity. So hopefully you get to the point where you don't have to do pacing, but absolutely can be a critical tool in the meantime until we find the real treatment. We also see here that beta blockers and attention deficit hyperactivity disorder stimulant meds helped a lot of people. But there are some people who definitely should not take these meds, as evidenced by the large number of people who had adverse reactions to these drugs, the people in blue. And there's lots of reasons why some of these drugs would not be a good idea. For example, if you have low heart rate, you don't want to take a beta blocker because that would further reduce your heart rate to maybe a dangerously low level. And if you have really high blood pressure, you probably won't want to be taking a stimulant medication because that can raise your blood pressure even more and it might reach a dangerous level. And there's lots of things like that for any drug. So just to note that. Oh, by the way, this score right here, this is an interesting thing they did. It balances the positive and negative reactions to give a total kind of efficacy score. So the higher the score means the better overall response, taking into account both the people who had a good response and the people who had a bad response. And so things like fluids and electrolytes and pacing, they have the best overall rating because, first of all, they benefit many people. But importantly, the side effects are really low because they're not invasive interventions or drugs that have a lot of side effects. Now, you can look through the rest of the list. My view of this is it's a sensible, logical list. Many of these are things I've tested or I am testing or I plan to test, and I really like the list. I should note, I almost missed this. I should point out that at the very bottom down here, graded exercise therapy is in a class of its own, with most respondents saying that that treatment actually made their condition much worse. So it's the only treatment with a negative overall benefit score. Let's look at one more figure. They also looked at subgroups, and they looked at 4 subgroups. Subgroup 1 was the more severe multi-symptom group, so their most severe ME/CFS. Group 2 was an orthostatic issue group, so symptoms that are exacerbated by posture. Group 3 was a brain fog predominant group, and then group 4 was kind of the mildest symptom severity group. And so you can see some interesting things here. Things like the group that responded best to the stimulants, the ADHD stimulant drugs, they were primarily the brain fog group, which makes a lot of sense. And the group that responded best to manual lymphatic drainage was the severe multi-symptom group. And if you've been following my videos over the last few weeks, we're really interested in this lymphatic and glymphatic drainage systems. So there's a lot more to the paper, but I just wanted to give you an introduction to it. And let me give you my overall assessment. As you can tell, I really like the paper. I like research groups utilizing patients' real life experiences because clinical trials are so expensive and they're so time intensive. And we can't test all of these things in clinical trials in any reasonable amount of time. So it's really good to use these other sources of information. I like their approach in prioritizing the treatments based on positive and negative responses. Really smart. So very good paper. Now there are limitations. The authors note as much. So I'm not saying anything that they don't already know. The big thing is it's self-report, and you all know why that's a potential issue. We're not sure that all the information is accurate. Also, because these are all coming from different places and different experiences and different doctors, there's going to be significant heterogeneity in the sources of the treatments, the dose, the duration of treatment, and you know, the difference between getting the right dose and the wrong dose, that can be the difference between something working and not working. And so some of that has got to be working its way into these results. But still, as you get larger sample sizes, like what we see in this paper, you can still trust that you're getting a general idea of the potential responses that people have when they try these treatments. So, what do we do with the paper? And now, for myself as a scientist, it's pretty easy. This helps me prioritize treatments for clinical trials. For you, um, I know it's tempting to try to use this as a kind of a shopping list of things to try, which makes total sense. I do want to throw out the caution that these treatments range significantly in their risk. Almost all of them have contraindications, not all of them, but most of them. So I would suggest that you run any of these ideas by your primary care provider first to make sure that the treatment makes sense in your case. I do want to make one more final note, kind of a statistical note, in terms of what's the likelihood that you would respond to these things. Even if you have only a 25% chance of responding to one of these treatments, if you try multiple of these treatments and they each have a 25% chance of benefiting you, then your overall chance of responding to at least one of them is going to be well over 25%. I hope that makes sense. If not, I'll explain it in more detail at another time. Anyway, so that was it. An interesting paper to review. If I made any mistakes, be sure to mention it in the comments. I try to get to as many of the comments as I can, typically on Tuesdays and Wednesdays after I post. And I look forward to reading your comments and reading your questions. So, bye.